Give us a second, Chris.
Okay.
Are we in yet?
You tell me, and we'll start.
I need to know when to tell them to go.
Chris. Yes. Okay.
45 seconds, Chris. Okay. Put my mic check, Chris.
Mic check 1, 2, test 1, 2. I got you.
What's that? Hey.
Good afternoon. We wanted to welcome everybody in and thank you again to our media partners for coming together to help us keep our community informed. As we described yesterday, the mission of the Joint Information Center is to speak with one voice, make sure that we're getting accurate data out to our community. This morning we were informed of our first case in Southeast Alabama of the COVID-19 virus. It is a patient that is currently being treated at Southeast Health and is being taken care of there. So to respond to that, to provide more information, I'm going to ask Mr. Rick Sutton, CEO of Southeast Health, to bring that information to us.
Good, thank you. So good afternoon. I'm Rick Sutton, CEO of Southeast Health. As you are all aware from the media release sent out earlier this afternoon, Southeast Health has confirmed, as of last night, the first coronavirus or COVID-19 case in this area. Now let me first state, the patient is in good condition and is in an isolation room at Southeast Health. We are following the Center for Disease Control and Prevention recommendations, as well as guidelines from the Alabama Department of Public Health and standard infection control best practices in treating the patient. We chose to follow up our media release with a press conference so that we can dispel any rumors or misinformation. As the healthcare leader in the region, I believe that it is important for you to hear the information directly from us. We also want to make sure that while everyone needs to take COVID-19 very seriously, you should not panic or overreact to this situation. This positive COVID-19 case has not changed what we're doing at Southeast Health. We have begun preparing for weeks to handle a case, and we implemented our plan of action, which includes treating patients in negative pressure infection isolation room. We have a team of physicians and nurses who are experienced in treating airborne infections. Some other things that we have done to prepare for COVID-19 are we've done extensive employee education and training. So this is computer-based learning modules, screening patients for signs and symptoms, following appropriate isolation rules, and knowing how to properly don and doff personal protection equipment. And most importantly, how to practice and ensure that we are practicing good hand hygiene. We began, one of the fears across the country is running out of personal protective equipment. And so we began preserving PPE by purchasing reusable surgical gowns that are being sterilized now after each use. We have done community education and increased awareness about COVID-19 in order for the community to stay healthy. We have canceled hospital-sponsored community events, and we urge others to do the same. This week, we have implemented or will be implementing the following operational changes. As of Friday, we are going to be canceling all of our elective surgeries and procedures. Now, part of this is surge planning efforts that we have carefully evaluated for the readiness of our facilities and our personnel and the supplies to ensure that they are available. As you all well know, we run at full capacity most of the time, and so this is a concern for us. So in conjunction with our medical staff, we did make this decision to cancel all the elective procedures and surgeries, and this happens and begins on Friday. This includes all elective surgeries and procedures, but does not affect urgent or emergent type of surgical care or procedures. We have implemented a strict visitation policy. We have announced a stringent healthy-only visitation policy as of today. In most areas, we are only going to allow one visitor that must remain in the room with the patient. We encourage social distancing. In all of our dining locations, they have been changed to grab and go only in order to practice social distancing, and we have temporarily closed all non-essential operations. Now, this is a time of anxiety for staff, especially if we're on the front lines, and especially if you have to be quarantined. And as this is an unsettling time for the community, it is also for our staff. Our team is on the front line and understand the occupational risks that go along with being there. But we need them on this ship with us, taking care of this community. So what we announced today is that we have made a decision to keep employees whole in terms of their compensation during this period. If they are quarantined, if they are put on precautions, we intend to keep them financially whole in order for them to stay on board with us as we go through this time of crisis. Dr. Harkness, would you like to say some words as well?
Good afternoon. I'm Dr. Charles Harkness, Chief Medical Officer. I want to talk a few minutes about what the public can do to protect themselves. I cannot stress enough the importance of consistently doing simple things to protect you from the virus. These include practice good hand hygiene. Cover your mouth when sneezing and coughing. Do not touch your eyes. Avoid social handshaking and hugging. Keep a 6-foot distance between yourself and others. If you're sick, stay at home. Avoid gatherings of 10 or more. And do not travel to international or domestic locations affected by COVID-19. What we do not want you to do is to flood the emergency room wanting to be tested for COVID-19. Our criteria for testing the virus has been unchanged. You must meet the symptomatic criteria and need hospitalization. If you do not need to be hospitalized, we'll be asking you to go home and self-quarantine.
So here's what I ask for the community to do. This is what we need the community to do in order to help us flatten the curve of infection. We are taking strong steps now to slow the spread. Follow the latest CDC guidance. Practice social distancing and stay home whenever possible. And we are also going to be setting up a COVID-19 public hotline that you'll hear about in the future. Finally, let me say this. We are all in this together. I know that there is a lot of anxiety about COVID-19 in the public, but rest assured, we are here to provide you with the best care possible. We will also continue to provide information and education about the virus through our website, which you have on the media release that we've provided. We have earned your public trust for health care over the last 60 years, and we continue to do that. We continue to do so for many more years to come. So with that, I'd like to turn it back over to you. Thank you.
We'll take questions in just a moment, but I would like to ask Mr. Corey Kirkland from the Alabama Department of Public Health to come up and just provide some comments from ADPH.
Thank you, Chris. I'm Corey Kirkland. I'm the Southeastern District Public Health Administrator. In light of the fact that this patient is from Georgia, our surveillance personnel in Montgomery have contacted the state of Georgia. That contact tracing and that investigation will continue there. Our agency will take on a coordinating stance from this end, and if the hospital needs anything from us as far as this investigation goes, we'll certainly work to provide anything they need. As far as recommendations from us, it has not changed, and in fact, I would say everything that they mentioned before is very important. I've noticed that some restaurants have already taken their seating out, they're drive-through only. We would encourage anyone who has not done that to go ahead and do that. If you're doing that, continue to do it. Continue with the good hand washing. Remember your cough etiquette. All those things are very important, as he said, in flattening this curve. If there's any elderly who are wanting to travel, do something, we would recommend that they not do that. Even recommend that they not engage in functions with family if they can avoid those as well, especially if they're in a more of a high-risk group going forward. If you have any more, if you need, or if you want to keep up with our press releases and those kind of things, there's on our website, which is alabamapublichealth.gov. And we're happy to, Chris invited us today, and we're happy to work with the community going forward.
We've got just a few minutes of our availability, so we'd open it now for questions. Anybody that has a question for someone on the panel, and I'm sure some of our subject matter experts from Southeast Health will be joining us as well. Anybody have a question?
I want to understand, this patient came to your hospital from Georgia because he was sick and got tested there, or got tested in Georgia and then was brought to the hospital, Mr. Sutton?
Yeah, they're not from Houston County, and they were tested, we tested them here. They are not from Houston County.
Any other questions from anyone or anyone on the panel?
One more question for
Sure.
Mr. Sutton. You said yesterday you had increased your number of isolation rooms. How many cases of this, as of today, understanding that you could change this again, would you guys be able to handle if there are more cases, which we expect there to be?
We have a total of 17 isolation rooms in the hospital right now, and we are looking to increase that number by 12 as we move forward. Now, stuff that we need to make that increase is still coming in, which are some additional fans. They're not all here, but the ones that are here, we're now converting rooms to create an isolation
I don't want you to go
situation.
into a great deal of detail, but tell us what an isolation room is. What is different about an isolation room?
You have more air going out of the room than you have coming in it. So that air, when you open the door, air from the room where the contamination is doesn't go out into the hallway. It is being sucked. So when you open the door, air from the hallway gets sucked in. So you keep everything in that contained area. That's negative pressure. That's what we want to have.
I've got one more question, I'm done. But as a long-time experienced person in this field, are we overlooking, and I don't mean to diminish these cases, but are we overlooking the fact sometimes that the vast majority of people that contract this virus don't get sick and recover pretty quickly? Is that big loss in the mind of Rick Sutton?
I think I'm going to leave that to a clinician to answer that one.
I think the piece of this that's the hardest is that younger people tend not to get very sick from this disease. So they don't take it very seriously from their standpoint, not understanding that if they're carrying the virus, and we've seen cases now where you can have no symptoms and shed the virus, you can shed it to somebody who's at risk. So that's the word we're trying to get out there, that if they'll do the things that we're asking them to do, they'll prevent the spread of this disease.
Anyone else? Yes, sir.
Do you have any idea of how many tests have been administered in Houston County so far?
I would not have a total for Houston County.
I don't know the total.
Yeah, we don't have that number right now of how many have been tested.
So following up on his question, are we talking 10 or are we talking 500?
That tests that have been
Right.
administered. I have no way of knowing right now. We don't have the compilation number that I could provide to you.
I know how many we have tested. Right now, we're at 10.
Okay.
Okay.
There you go.
So it's not in,
So in
the
one
supply
facility,
chain is an
10.
issue right now.
There may be private labs doing tests that we're
Right.
not aware of.
Yes, sir. Okay. Anything else? Again, we will continue to provide updates as we get them through the Joint Information Center. Encourage everyone to stay in touch with all of our media outlets. They are tremendous partners to get out this message from our healthcare providers, CDC and ADPH. I think everyone's doing a tremendous job. And we will send out releases and notifications as we need to bring folks together and get information out. So thank you for your time. Yes, sir.